I think when we came home, we were so pleased to be home because it was Christmas Eve, and it was just so nice to be back home for that day and to think that we were going to be together as a family on Christmas Day. Um, that we really were quite happy to be home, and didn't really think about the day that she came home as being a problem at all. But I think by Christmas Day we started to see the difficulties that we were going to have. One of the main things was that because she's not able to move herself easily, she's got very low muscle tone. Sophie was having to be repositioned a lot, particularly at night. And so that for us was meaning to get up and to change her position a little bit to try and help prevent her getting any bed sores or pressure sores, this kind of thing. The hospital bed really helped us because you were able to hire it up, and so you were working without having to stoop down or bend over. And also when you were picking her up, it was much easier to pick her up off a higher surface, so that was pretty good. We went out Christmas Day, actually, put her in a buggy, wrapped her up warm, and we did long walks. And actually every day she was in the hip spiker, I went a walk with her, and just for an hour maybe. And she was really happy to be outside, and really, you know, she loves being outside, and so that was really the best thing for her, was to go out in the buggy as much as possible. The main problem we had with her was because she's got very complex special needs. She wasn't able to play, for example, like a typical child would. So you couldn't give her a jigsaw, she couldn't colour, she couldn't write or do any of those kind of things. Her play level is still very much of a 1-year-old, really. So it was very difficult to keep her occupied. We had to keep changing her position to play, for example, so she'd play with her truck or the tambourine or something like that, and then that would be that, and then we'd have to change her, and it was quite difficult in that respect. But one of the aims that we always had was to get her into school when she was in the cast, and that's what we worked towards. We worked towards her getting off the pain control, so that we could take her to school in transport. Luckily we were able to get transport for her, so they secured the buggy in and then they took her into school. I went into school for the first week and I worked with the teachers and teaching assistants in lifting, napping, toileting, this kind of thing, and really showing them how to deal with her in the cast. And she went to school for 4 weeks without any problem at all, and that really helped her, I think, from a mentally stimulation point of view. That was really helpful to her to go to school. And I think that it was good for us too, because we had a clean break for the day where we could also get on with other things in life. So that really helped. I think from the fact that she can't communicate was also quite frustrating for her, because of course she can crawl without the cast and everything, but in the cast she couldn't do anything. So it really was a frustrating time for her, and I think school really helped her that way. So that was a good thing to do, and I'd recommend, if you can do that, and if your school is supportive enough, then certainly it's a great thing to do. From the position of hygiene, we did top and tail, and really looked after Sophie like you would a baby in a hip spiker, actually, because she wasn't toileted, so she could wear nappies, and we did the nappying side of it for her and everything, so she wasn't having to worry about that side of it. Top and tail we did every morning, every night, and she's got lovely long hair, and we decided in the end that it was just too traumatic for her to wash it, because she's such a big girl, and particularly in the spiker we had no easy way of doing it, and we thought it would be just too frightening for her to to be suspended over a bath or a basin. So we decided in the end the hair would see how it goes without washing it. And we used dry shampoo, and we just didn't wash it for about all the time she was in the cast. And after a while, actually, it started to self-clean, and I think that really we did the right thing, that we didn't put her through trauma by washing it, and we just let it clean itself. So from a hygiene perspective, actually, in the end, it was quite easy for us to do, and I think the main parameter was the fact that she didn't need toileting as well, so that made things a lot better for us. Yeah, one of the things that we had to watch out for Sophie, because of the positioning thing, we did ultimately find that she had a pressure sore at the back of her, on the back and spine area actually, and she'd had this before when she was in the cast when she was 2. Unfortunately, she caught chicken pox when she was in the cast that time, and there was a little pox just on the spine at the back. And of course, because she's on the back quite a lot, it just rubbed and rubbed and rubbed. And I think this time where the pressure sore came was exactly the same spot where the skin probably wasn't that thick. And so it really was a shame that she got one. And again, we had to just keep repositioning her off it. We had to dress it. We had a community nurse come in to dress it as well, to stop it from getting any worse, really. And we tried our best to put as much padding around it as possible and keep her on her front as much as possible to try and get it better. But it was a real shame that she got this sore. In order to try and keep everything else working correct, we actually had physio while she was in the cast, and she was able to, even in her hospital bed, she was able to use the monkey bar to lift herself up. And you could tell the way she lifted herself up as well, she really was really careful of this sore on her back, the poor thing. But she was really using that, and the physios would get her to do sit-ups in the cast to try and use her abdominal muscles, to put weight through her arms, and also try and put weight a little bit in her lower leg area to try and keep the muscles going there. So she had a quite extensive physio program even before she came out of the cast. Yeah. One of the other things about trying to put her on the front was trying to find ways of supporting her, and one of the big ways we found, we've got this huge big black bean bag, and we put her on the front there, and she was able to kind of toop over the edge and go ooh, and play at front of that. At school they got luckily a physio wedge, what they call a physio wedge, and it's like a big piece of cheese, very steep at one end, very narrow at the other, and she'd lie on that and again play over the front, like having a bean bag really. Sophie, from the point of view of eating, is a famous eater. She'll eat everything and anything that's put in front of her. And I don't think that really changed for her when she was in the cast. I think that really the only thing that changed was the quantity. She ate lots less, really a lot less. I would say also that her reflux issues started again when she was in the cast. She has very mild reflux, but when she was in the cast it was really quite extensive, so we had to increase her reflux medication. Every time she would eat it would come back up again, and it's really just to do with pressure and volume available for food to go down, so you have to give little and often, and that's what she managed with. She didn't change the types of food she ate, it was just much less. And I would say that also the codeine has a big effect on their appetite, and she certainly became constipated with that particular medicine, and it wasn't until we took her off that she really started to eat a little bit more, because she was just bunged up right from the start really with that. So that certainly helped as well. The medication can not really help the food problems, but certainly from the point of view of food, she was fine when she came out of the cast, just smaller quantities when she was in it, yeah.